All right, so as I enter the room, I am obviously going to introduce myself. Hi, Mrs. Mama Bear. I am Claire. I'm going to be your nurse today. Um, oh, this is Moose, your son. Oh, so nice to meet him. And I'm definitely going to make sure I have my supplies with me. I have my stethoscope, and I am making sure just to observe what Moose is looking like today. And um, thinking about whether he really looks sick, whether he's up and playing around, what his facial expressions look like, what his temperament is. I'm also thinking about his level of consciousness, some of those neurological things, and his level of consciousness and his behavior and temperament as well. That can really tell us a lot. I'm also throughout this going to be considering his level of development because that affects the kind of care that I give him. So he's about 18 months, so we're going to think about that for the levels of communication that we give and what kind of things we actually do need to assess, fontanelles, and thinking about what the normal ranges should be for that and his vitals, as well as just the fact that he is going to want to sit with Mama Bear during this. So yeah, we're going to go ahead and get started keeping him on Mom's lap, and we're going to do, while he's so quiet right now, I'm going to go ahead and auscultate so that I can get good readings on those kind of things. So I'm going to go ahead and listen to his heart and lungs first with my stethoscope. First, I'm going to listen to his lungs. I'm going to do 2 on each side, listening to both lobes. So 2 in the front on one side, 2 on the other side, so 4 in the front. And I'm listening for clarity. I want to make sure that I'm noticing the symmetry here. I'm observing the depth and the effort of his respirations, right? So I'm going to do 4 on the back as well. Listening for those clear lung sounds. Yeah, I'm looking for the depth and the effort of his respirations. Seeing if he is having to work pretty hard to breathe or not. I'm also looking for symmetry here in his chest, just making sure that the chest rises together. And then I'm going to go ahead and listen to his heart, looking for regular rate and rhythm here. And I would listen for a full minute to get his pulse. And then I'm going to also take his brachial pulse right here now. And I could try to find his axillary if I wanted to. So since I'm auscultating, I'm going to go ahead and listen to his bowel sounds as well. I'm going to do the 4 quadrants. And while I'm doing this, I'm listening for regular bowel sounds. They're sounding good. And I'm noticing too that his belly is looking soft and round, which is good. It's a normal finding. I'm also going to palpate his tummy. And it's feeling soft. Now I'm going to start looking at some of his extremities. Actually, I think I want to do his face first. So I'm going to go ahead and look at his head. Just observe for symmetry just from a distance, making sure that his ears and eyes are symmetrical with his nose and mouth as well. I am going to look at the mucous membranes, maybe have him open his mouth, or if he's been crying, just kind of notice that, making sure that they're pink and moist. Also observing for any edema or any like exudate or like discharge from his ears or nose or things like that. Making sure that the color is good in all these locations as well. And then I'm also going to feel his fontanelle. I'll feel his anterior fontanelle, making sure it's flat. His posterior will already be closed at this point. So now I'm going to look at his extremities, and I'm going to just kind of feel his muscle tone and strength. Observe like how he's moving around while Mom's holding him, if he's kicking a lot, how active he is, making sure that I can feel his strength here and feel that muscle tone as well. I will also look at the capillary refill time here. We want it to be under 2 seconds. And I'm going to be observing his skin throughout all of this, just everywhere I go too, for temperature, turgor, integrity, moisture, and color. I'm going to be observing his extremities for color, making sure that his extremities are getting good circulation, feeling warm. And I'm going to look if there are any incisions that he's had, like maybe he's had stitches. He's looking good today, but I would make sure those are clean, dry, and approximated as well. So that's about all for our physical assessment. Now I'm going to ask like the physical part of it, and I'm going to ask Mom just a few more questions. So I'm going to ask about urination. So what is his typical urination like? How is his urine? Is it clear? Is it concentrated? Things like that. And for gastrointestinal, how are his bowel movements? Does he have any diarrhea? Any nausea or vomiting? Things like that. Along with that, how is his nutritional diet? What is his diet like? Tell me a little bit more about that. And how does he tolerate that diet? Can you tell me more about that? Okay. And tell me a little bit more about his sleep patterns and his rest. And if he ever has any pain that it appears to you and the cause of that. And then lastly, could you tell me a little bit about your stress, ways that you cope with that, and just kind of the family support systems that Baby Moose here has around him? Okay, great. Well, that concludes our assessment today. I will let the provider come on in and talk to you. It's been great speaking with you. Thanks, Mama Bear. Bye.